So I'm one of the first opinion vets. I'm mainly involved in sort of the general practitioner side of things at Pride. I do a range of surgeries, consultations and also sort of preparatory procedures as well. I actually came to Pride as a student, so I graduated from Nottingham, so I saw practice at Pride. 3 years later, I decided to join Pride. I was at a 5-vet branch back in Newark, and then I did a bit of Vets Now, so emergency work, and then I thought I needed a bit of a change, so I came to Pride. So usually if I was doing ops, which is what I do majority of the time, I'd admit the patients in the morning and go through to operating theatre, do those procedures, write those notes, and then ideally discharge those patients as well. Occasionally we do get the emergencies that come through, which means you end up not being able to discharge your patients, but routinely you'd admit a patient and then see them through the day and discharge them to the client at the end of the day. So with regards to being a first opinion vet here, it is very easy to actually end up referring all the cases to the referral specialist. So it sort of started lacking a bit of case control and managing the cases myself. So I was looking for a different way of dealing with that. Pride is trying to expand. There's loads of other branches elsewhere already. So we're trying to branch out into Nottingham. And Wollerton's going to be a self-sufficient first opinion practice with an X-ray machine, ultrasound, basically all the facilities you'd need to carry out first opinion vetting. So it's opening end of October, so very excited to be starting that as a new job role. It was one of those discussions that I did mention that, I was feeling like I was lacking that sort of independence with managing my cases, and then it was something that they suggested saying, would you be interested in taking on a role at a new branch? So yeah, it tied in well. With regards to training, you can do certificates as first opinion vets. I was initially looking at a certificate option, but then Wollerton came about, so ended up sort of venturing towards the management side of things. There is CPD, there's usually always a CPD once a month, and you can invite sort of external vets as well. So I tried to go to all of those, time permitting, but yeah, Pride is a place where they do allow a lot of CPD, and we do end up learning a lot just from each other as well. So. Yeah, majority of the time. So the medics are really good at sort of giving advice. So if you have a difficult case, so for example, today I did have one, and you just approach them to ask for some advice. Is there any other medication they might advise? Is there anything that we've missed on our differentials list? And as far as surgery goes as well, if there's a case that you can't manage under first opinion, they're always willing to sort of take it on board as a referral surgery. Referral specialists are here, just next door. So when I was working at my old practice, you'd have to ring up to speak to a referral clinician. They've not seen the case, they don't know the history, so it's just sort of a verbal communication without that much of a relationship. But the referral clinicians here are very approachable, so you do end up having a long conversation about certain cases and procedures as well. Some of them you can scrub in if you want to sort of watch them do an op, for example. So that's one of the main things about Pride that is different. Yeah, probably the one I just did today actually. It was a little boy, older boy who had high liver enzymes. It came on quite suddenly, so we thought initially that it might be a toxin. We treated him with liver protectants. Unfortunately, the liver enzymes kept creeping up. We did a CT scan today. Again, another thing about Pride is we can use those facilities as first opinion vets, which is very rare in other practices. And we did notice that he had a shunt, which isn't great news, but it was a nice resolution to the case. And he's very bright and very loud, so I'm sure he'll make a great recovery. So yeah, that was one of the top cases.